Today we talk about blighted ovums, why they happen, what they mean, and why some pregnancies seem to start strong but never develop an embryo. I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday. Did you know that in nature, some reptiles will lay eggs that seem they're perfectly normal? But then when you crack them open, there's something wrong. There's no embryo inside of the egg. Well, in humans, something similar can happen. A pregnancy that looks normal, feels normal, but isn't normal can happen. And there's a sac like the egg, but there's no baby inside it. So today we're going to break down the science of blighted ovums, why they happen, and what do they mean for future pregnancies. Sometimes these blighted ovums are called anembryonic pregnancy, meaning no embryo in the pregnancy. And from the standpoint of a patient, you would actually never know that something is wrong. Matter of fact, it's not uncommon for these not to even be diagnosed until women come into their OB appointment around 12 weeks. Now, in fertility, we catch them earlier because we're doing ultrasounds earlier, and so we can catch them earlier. So some of the things we're going to talk about here are what causes them, why do some people misdiagnose them, and is there any way to prevent them? Now, to truly understand what a blighted ovum is, you need to understand a little bit more of the science of a blastocyst. A blastocyst essentially has two parts. There's a trophectoderm, which becomes the placenta, and then there's the inner cell mass, which becomes the embryo. So if we look at the analogy we said earlier about the egg, the trophectoderm is kind of the shell, the egg in some ways, and the inner cell mass would be the embryo. And so a blighted ovum is when the ICM fails to develop, but the trophectoderm keeps growing. And because it keeps growing, it produces HCG because that's where the HCG comes from, the trophectoderm. And so now your pregnancy will be positive. And not only will it be positive, but all of the symptoms of pregnancy will be there. The nausea, the morning sickness, the increased reflux and constipation, pretty much everything of pregnancy will be the same because the HCG that's being made is going to cause progesterone to go up, and that's going to cause all the symptoms of pregnancy. Now, what's interesting is a lot of clinics, when they see a patient, will call something a blighted ovum when it's not. And what they're looking at is they're saying, well, the embryo never grew. But that's not a blighted ovum. It's not an early loss. It's when the embryo doesn't develop. And one of the first red flags of that is if there's no yolk sac when you look at the embryo at around 5 weeks, 5 days. The yolk sac comes from the ICM. And so if that is gone, but you see the gestational sac, which is the trophectoderm, then you know there could be the possibility of a blighted ovum. Now, before you get scared if that's your situation, keep in mind that sometimes it's just hard to see the yolk sac. And so what we do is we usually bring people back a week later, we take another look, and then we go, oh, there it is, and then we're not as concerned. But that would be the first sign that it may be a blighted ovum. That's one of the benefits of fertility is that we do early ultrasounds. So by 6 weeks, we already know something is wrong. But it's different if you're not going through fertility treatment or if you wait to do your first OB scan until about 12 weeks. What will happen is you'll go in and they'll notice there's a big sac and no baby in it. And that is extremely difficult to even comprehend. And you feel like the whole time you've been pregnant, and you have been, and you feel like the whole time that baby's been developing, but there was never a baby. And from your standpoint, there was no different. You would never have known that it was an empty sac. So what's interesting is that the trophectoderm, which is the placenta, can keep growing and keep you from bleeding up to about 12 weeks. Now, around that time, things start to get spotting and may pass at that point. But the main point here is that you can even go into an OB scan at 12 weeks and find out there's a blighted ovum, which seems devastating. So, what causes a blighted ovum? Well, as we just discussed, as long as the ICM doesn't grow, then that's a blighted ovum. But a lot of times it could be for other reasons, meaning it doesn't have to just be an error. It can be something wrong with the DNA. So for some reason, if it's aneuploid and the embryo is dividing and something goes wrong because of the chromosomes, that would be a blighted ovum. If it's due to something, let's say, for example, just development, when the embryo is dividing and something goes wrong that disrupts the formation of the ICM, that again is a blighted ovum. There's even theories out there about trophectoderm overgrowth, where the trophectoderm may overdevelop so much that it suppresses the ICM, and that can cause a blighted ovum. But what all these factors have in common is the ICM didn't develop. Now, what's frustrating about it is you really can't prevent it. And the reason you can't prevent it is because there's multiple causes, and it's not just genetics. Even though a lot of them may be, you can put back a PGT, a normal embryo, and still have a blighted ovum. Now, the good news is most people just go on and have normal pregnancies after that. Rarely do you see people come back with another blighted ovum. That's not very common to have that repetitively. Now, although you can't prevent a blighted ovum 100%, there are things you can do that may reduce it, such as if you do PGTA, you're going to at least remove the chromosomal problems that can lead to that. But one of the common myths out there is that a blighted ovum might be your fault. That is absolutely not true. There is no lifestyle factor that can cause it. It's essentially a biological event that happened by chance. Now, as I mentioned, because it's still making HCG and you're getting all the symptoms of pregnancy, you feel like everything's good, when in reality it's not. And so the question is, for someone going through fertility, you're going to know about it very early. But someone who's got pregnant naturally and showed up at their doctor's at 12 weeks, they're going to find about it then. And then the question is, what do you do? How does it go away? And so if you're someone who, let's say, is having spotting at 12 weeks at your OB, you could theoretically just wait and let things naturally miscarry, because it's probably going to happen pretty soon. But the problem is, if you caught this early, like at a fertility ultrasound at 6 weeks, well, your body's not going to recognize an issue until potentially 12 weeks. And then the question is, do you wait 6 weeks to allow this to continue to grow until it outgrows its blood supply and then miscarries? And so there are some other options in that situation. One of those options is a medication called misoprostol. And what that will do is that will get your body to realize something's wrong and will help it miscarry naturally. The other option is what's called a DNC, which stands for dilation and curettage. And that will be able to remove the pregnancy tissue surgically, and that way you don't have to wait for things to happen. There is no wrong or right. You can either do the expected management and allow it to happen natural, the medication management, or you can do the surgical management. But what's important to understand is, unlike other type of miscarriages where the body will recognize it soon, this is different. The placenta will keep growing, and because it will keep growing, it could take weeks, even a couple months, before your body recognizes that something's wrong. Now, the question is, what happens afterwards? So depending on what you do, if you end up doing the expected management or the medical management, it's probably going to be good to follow it up. You're going to watch the HCG levels go down, and you're going to do a sonohistogram to make sure everything did pass before you go on to other fertility treatments. Now, if it's a situation where you're doing the surgery, then you know everything was removed. And so at that point, you can move forward right away. Now, as I mentioned before, for most people, they'll experience just one and then go on to have healthy pregnancies and never have another one. Now, having one also doesn't mean you're going to have more of them in the future. It doesn't mean that now there's something else wrong. Again, it's just usually an error in development. Now, if you are having multiple of them, then the question I would ask is, one, is it being diagnosed incorrectly? I've seen many charts I reviewed that will say they had blighted ovums, and I see a yolk sac on it, and that's not a blighted ovum. That's an early miscarriage. So it's important that it gets diagnosed correctly. But the other thing is, if it's happening multiple times, it could be an issue with the chromosomes. And that's where PGT may come in, because there might be a reason you're having those very, very early miscarriages before even the embryo develops. Personally, I have never seen this, but I know theoretically it could happen. But most of the time, when I see someone with recurrent blighted ovums, when I go into the data and look at it, they weren't blighted ovums. No matter when this happens, whether it's 6 weeks or 12 weeks, it is going to be emotionally difficult. And it should be. Losing a pregnancy, even without an embryo, is still a loss. But what makes this so difficult is the confusion. Because when you're told there's no baby there, but you've been feeling the pregnancy, it's something you couldn't even fathom. When you see that pregnancy test and you know that everything is potentially going well, it is confusing to then be told there's no baby. And you can start looking for answers, thinking maybe I did something wrong. And there's a lot of frustration. And a lot of times people don't even believe the diagnosis. And that's why we usually will do another ultrasound to make sure that you feel comfortable knowing that this is truly the diagnosis. I think it's important that if you do come across this, there are support groups out there, counseling, and other things that can help the healing process if you had to go through this. A blighted ovum can be a confusing and heartbreaking experience, but it's not the end of your fertility journey. As I mentioned, most women who experience one go on to have healthy pregnancies. So if you've been through this, you're not alone. You'll be surprised at how many people have had blighted ovums. There's support groups out there, and there's people you can talk to. If you did have one, I'm sorry. There is never a good miscarriage, but I know this one's very difficult when people have it. I hope this episode doesn't scare you. There is concern when you get pregnant that there can be problems, but most time things go fine. Next week, I actually plan on doing a podcast about when is it safe, and kind of talk about these issues. What is your chances as you keep going and how far along you get? But in the end, if you're someone who had a blighted ovum or know someone who did, tell them about this podcast. This may be helpful for them to know they're normal, they're not alone, and this can happen to people. It's not easy, but then they can be reassured that most pregnancies will go on to be just fine. As always, I greatly appreciate everyone who listens to this podcast and tells everyone about it. It is because of you that we are growing and we're helping educate everyone about fertility struggles and some things that other people don't talk about. I try to bring analogies and science to these conversations, but most of all, not being superficial and trying to give you the actual data and the science, so that way you can be an advocate for yourself. Just like we talked about today. If someone told you had a blighted ovum, but there's a yolk sac, you're going to know that that was incorrect. So like I said last week, if you love this podcast, keep telling people about it. Give us a 5-star review on your favorite medium, but most of all, keep coming back. I look forward to talking to you again next week on Taco Bout Fertility Tuesday.